Everyone, welcome to 2 Minute Cardiology. Today I thought I'd talk about atrial flutter. Not atrial fibrillation, but atrial flutter. Sounds like fibrillation and kind of works the same. And most of these patients need anticoagulation, just like those with AFib. We spoke about the CHA2DS2-VASc score in a previous talk. Okay, so atrial flutter, unlike AFib, is on the right side of the heart, not the left. And it's a re-entry type of rhythm. Oops, it usually goes counterclockwise. And it's between the inferior vena cava and the tricuspid valve. Now, you can treat that several ways. You can lower the heart rate, or you can go to the hospital and get a psh, and that really corrects it. It's very easy to do. It's harder to lower the heart rate with A-flutter than AFib. But what usually cures it is something called an A-flutter ablation. Because as I said, it's between that inferior vena cava and the tricuspid valve. They call it an isthmus. And a single little ablation usually cures it. The problem is, with ablation, 80% of patients maintain sinus rhythm. But look at that, 36% only with the drug maintain sinus rhythm. So ablation is the way to go. But the problem with A-flutter ablation, and you need to speak with the electrophysiologist, is this. Remember what I said, that right atrial A-flutter is kind of like the cousin of AFib, but AFib's on the left side, but lots of patients end up having atrial fibrillation. That's much harder to treat with an ablation. Number one, you have to poke a hole in your heart when you treat AFib and not A-flutter. If you have any further questions about atrial flutter, you want some recommendations on perhaps where to seek care for atrial flutter, please contact me at drevanlevine@gmail.com, drevanlevine